Hi and welcome back to Nurturing Moms. In this video, I really want us to discuss about cesarean birth. I talk a lot about a vaginal birth and what positions you need to take and how to cope in labor and how you should have a doula in your vaginal birth delivery when you have spontaneous labor. But in this video, I really want us to discuss cesarean section birth because sometimes it happens unplanned and there are some various reasons as to why you might be advised by your healthcare provider as to having a cesarean. So let's talk about that. My name is Shira and you're watching Nurturing Moms. So a cesarean birth is a birth where there's an incision made on your uterus to be able to get your baby out, and that's how they're born, by a cesarean birth. So it's a type of abdominal surgery. So you cut through your abdominal muscles into your uterus and take your baby out. So there are some reasons as to why you may not actually go into labor, and your doctor might advise you straight away to have a cesarean birth. Now, one of the reasons that you might have a cesarean birth is failure to progress while in labor. So yes, you're laboring, your labor started very well, and all of a sudden you reach at a maybe 4 centimeter mark. Your cervix is 4 centimeters open, and you've been there for about 10 hours and there's been no progress, and they're like, okay, mother hasn't progressed very well. So they decide, let's put up a drip of syntocinon, which is a synthetic form of oxytocin, to try and help increase the power of your contractions, hoping that that pressure will open up your cervix a little bit more. 5 hours down the line, you're actually at 5 centimeters. So you've been in labor for 15 hours and you've only gone up to 5 centimeters. Mother is tired, they're continuously monitoring the baby, but your doctor feels there's something wrong and you're not progressing as you should. Because normally, theoretically, it's 1 centimeter per hour. 1 centimeter per hour, but labor, I'll tell you, is very unique. So it doesn't happen like that all the time, but that's the theoretical advice that you get, that 1 centimeter per hour, you should move up. Now, sometimes they say that you're experiencing cephalopelvic disproportion, whereby your baby's head is bigger than the pelvis, so the baby is not able to enter into and engage into the pelvis. So no matter how long you're in labor, baby is not coming down, so you're advised to go for a cesarean birth. Another reason as to why you'd be advised to go for a cesarean birth is your baby's heart rate. Your baby's heart rate should be about between 120 beats per minute to 150, 120 to 150. So let's say your baby's heart rate is monitored and you're in labor, you're probably at 6 centimeters, and the heart rate is about 100 to 110, and then it's going down to 90 and back to 100. That's not a good sign, because it's showing your baby's getting tired, and that's called bradycardia, when you have a low heart rate. Now, it depends on how far along you are in your labor. So for example, you're at 100 beats per minute, your baby's heart rate is at 100, and you are in second stage where you're pushing your baby out. That's not a concern, because they know in another 10 minutes, your baby will be born. But if your baby's heart rate is that low and you're at 6 centimeters dilated, you kind of probably have another 4 hours to go, then you might have to go for a cesarean birth, because it shows that your baby is not coping very well throughout in the labor process. Another reason as to why you might be advised to go for a cesarean is if your baby is lying in breech, and that's bottom first, buttocks first, or legs first. That's the breech presentation. Normally you want your baby head down, that's a cephalic presentation. So if your baby is in breech, usually doctors would advise for a cesarean birth. However, I know if you are giving birth somewhere in northern Kenya, you're being assisted by a traditional birth attendant, she will help maneuver your baby to turn down head first, and they'll birth your baby. If that doesn't happen and your labor is progressing and your baby is presenting legs first, they are able to help you birth your baby. But I know in an urban setting, you're with your private doctor, they are afraid of the complications that would occur, so they actually would advise you to do a cesarean birth. However, there are different positions that you can try to help turn your baby head down, and there's also the manual maneuver externally on your belly. Another thing that might happen that the doctor will advise you to go for a cesarean section, it depends on your health as a mom. Are you having high blood pressure? Are you having diabetes? what's going on with your health that may not allow you to have a spontaneous delivery. Okay, sometimes you'll be induced before 40 weeks. So maybe at 38 weeks, the doctor will say, come in for an induction so that we don't wait for 40 weeks to take place. Sometimes, unfortunately, with induction, they sometimes fail and you still end up going for a CS. But this is information I'm giving you, but you would have to discuss with your doctor, depending on how he feels as he's walked this journey with you, what would the best type of birth be for you as a mom. Another reason why you might be going for a CS is if you're carrying twins or multiples, triplets, quadruplets, that's what I mean. So if you're carrying twins, 50% of most of the time, 50%, you go for CS. The other 50, you can actually have a vaginal birth, especially if both twins are head first. It's okay, you can have one. But if they're not, chances are you go for a CS. For triplets, quadruplets, normally it's a CS, okay? If you have a condition called placenta previa or placenta abruption. I know these are difficult words, but this is it. Placenta abruption is actually when your placenta peels off the wall of your uterus. This is usually an emergency situation and it will affect the health and well-being of the mom and the baby. So that is a CS going to happen. Placenta previa is a low-lying placenta. So for example, if you have a complete previa whereby the placenta is covering your cervix, where that your baby has nowhere to go through into the cervix, into the pelvis and out, then that area is completely covered and blocked, you will go for a cesarean section. So these are just some of the points and reasons as to why you might have your doctor advise you to go for a CS. Please talk to your healthcare provider. Understand why they would want to have you go for a CS and what are the risks or the benefits of not going for one. Just understand all these things as you plan to have your baby. So in the childcare classes that I do, I normally discuss cesarean. Yes, there's a lot of talk about vaginal birth, but it's important to also cover cesarean because sometimes, and most of the time, it's either an emergency or it's been unexpected. You've been progressing well in labor and all of a sudden you're told, okay, baby's not doing very well, her heart rate or his heart rate is going down, you need to go for a CS. So you need to plan and understand what happens during a cesarean section, and that is something that's covered in the classes. I wish you the very best in your journey of pregnancy. My name is Shiro Shera and you're watching Nurturing Moms.